And here we go. Welcome everybody to The Big Idea. I'm Dr. Jeffrey Hanna. Today we are looking at MRIs, particularly ligaments. And this is a video that's done for people who are experiencing some kind of health issue. You believe it's related to something wrong with your head, with your neck. You've had an MRI, but the MRI came back as saying that everything is normal. We're going to have a look at a few things that just because things may say they're normal doesn't necessarily mean that they are. Now, let me back up just a little bit here. When a radiologist is looking at an MRI or any diagnostic scan for that matter, blood test, x-ray, CT, anything like that, they're looking for overt pathology. Things that are bleeding, broken, growing where there shouldn't be, tumors, infections, things like that. What they're not necessarily looking for are functional disrelationships. They're not trained to look for these kinds of things. And this is where the advanced, studies that we do are oftentimes useful for helping people who are in this gray zone. You don't have overt pathology, but there is something that is still clearly not right. And got to give a lot of credit where it's due first and foremost. I've studied MRIs for a number of years, but as part of my advanced certification program I'm going in the moment, about 2-3 weeks ago, I had a course with Dr. Scott Rosa. He is an upper cervical chiropractor and really the pioneer with looking at these kinds of MRIs, the studies, and he was our teacher showing us so many of these different kinds of things. And interestingly, not coincidence, I would say this is more synchronicity of things. Had a client who was currently working with who brought an MRI. They've only recently started to experience brain fog, disequilibrium, abnormal sensations in the head, pain in the neck, and this person had had injuries going back quite a few years. But they had an MRI that came back as normal and asked me to have a look at it. This is what I saw, and I'm going to showcase, and this is where I want to give credit where it's due, is we're always learning new things. Yes, you've seen me review MRIs on this channel before, but the stuff that I'm going to showcase in this video, this is stuff that I didn't know about if you were to even rewind the clock 4 months ago. So we're always learning, and I want to share this information pretty much right away because these are some of the things that can be very important on the MRI that's, quote, normal, that may explain a little bit about what you have going on. Let's jump into it. Now, I always preface when I'm looking at advanced scans like this, I don't expect you to know 100% of what you're looking at. I'm going to try to point out and give the general descriptions about what the various structures should look like so we can at least get a bit of an appreciation. And if you're still looking at this wondering, I don't really see it, that is okay. First and foremost, took me a really long time to be able to see this stuff, and I'm sure that there's going to be a lot more learning I'm going to have to do as time goes along. So what we have here, first and foremost, is a mid-slice cut sideways through this person's head. And even if you don't know all of the anatomy, you can probably picture, okay, there's a brain, there's a nose, there's a mouth, so this person is facing this way. And I'll hope to orientate you a little bit. So this would be where the top of this person's neck is, located right across here. This big knob that you see, this is the C2 vertebra. It's supposed to be shaped that way. And then here's a C3, here's a C4, and then the spinal cord is this thing going on down through here. Now, ideally, I would have had a lot more slices and a lot better resolution, but these are just sharing the images that were brought forth to me, so we did the best we could with the information that we had. So one of the first things that I do want to point out is this darkish gray stuff that we see right up through the top here. On this particular MRI, fluid is dark black. And this is a little bit more than it should be. Not to the point of overt pathology, but this is a little bit more than it should. This represents where there is swelling or congestion of fluid in the frontal cortex. The frontal cortex is responsible for logic, cognitive thought, personality, our ability to do math, our ability to do complex reasoning, different kinds of things like that. And if there's ever a pooling effect here, what are people going to describe? They're going to say, I feel foggy in the head. I feel brain fog. It's not an overt diagnosis because it means a lot of different things. But that usually means something is not quite firing right. So what we're seeing here is a little bit of evidence where there is some swelling, not of the brain itself, but the accumulation of fluid on the inside. What I'm next going to point out here are all of the things that are pointing at with the pink arrows. Let me move that one in there just a little bit. And what I want to illustrate here, and this is going to be important for all the other slices that we're looking at the ligaments of the cranial-cervical junction. The ligaments are the connective tissues, they're made of collagen, that are designed to hold your head on top of your neck. And these particular ligaments are exceptionally strong, but they can only stretch about 5% before they start to tear. Now, this is going to be an important little bit of distinction because when we talk about tearing of ligaments, we need to qualify a few things here. You have different levels of injury. Number one is what's called a grade 1 sprain. This is where only a few of those fibers have tweaked. They're thinner, and it's usually still a pretty stable condition, but it's where, there is a little bit of damage. A grade 2 sprain, this is where at least 50%, or really it's more like at least 30 to 60% of those ligament fibers have sheared, they're torn a little bit more like this. And this is where we're starting to get where things begin to move a little bit more than they should. And when things are moving more than they should, this is what lowers the threshold, makes it more likely that we can experience pain or other problems in our body. A level 3 injury, this is where a ligament is completely torn. It's not stable. These are the kinds of things most commonly that the radiologists and the pathologists are looking for. But, and this is my point, is anything less than that, even if it is thinning, they're usually going to not comment on it. They're going to say that it's normal. But we can still see evidence that there is damage to the soft tissue structures on the inside. And this is what I'm going to be pointing out. Ligaments, when you're looking on an MRI, should be pure black. And when I say black, I mean like this color black right here. Not shades of gray, certainly not shades of white, but should be pure black. And when you follow their course and their contour, you're looking then for areas where it is not pure black. So what I'm going to do is I'm going to start on the front of the vertebra through here, and we're going to start working our way up. First and foremost, you may notice I don't actually have a pink arrow right here, but you can see this contiguous black structure here. And right down at the very bottom, it's not as contiguous black. This would mean that we have thinning, we have damage to this particular ligament. This is the one that's responsible for maintaining the curve in the neck, maintaining the integrity of how the vertebral bodies are stacked on top of each other. As we come up a little bit more, same thing right here. You might be able to notice these little speckles of white right through this area right here. You may have to zoom in just a little bit, but you'll notice this is not pure pitch black. So, bit of damage through here. We keep coming our way up, and then we're seeing at the level of the C1 as we're going to where it would be attaching at the base of the skull. This is what's known as the anterior Atlanto-occipital membrane. And you can see that this one here is quite a speckled version of gray, meaning that there is thinning. There is a sprain of one of the ligaments right up at the top that supports and anchors the head onto the neck. This means there's going to be a little bit of abnormal movement going on in that particular area. Oh, but wait, there's more. If we're following from the back of the vertebra and we're coming up, again, I missed a little bit of a pink arrow, but you'll notice right through here that this structure should be absolutely pure black. And you can see this shade of gray. We'll see that from a slightly different slice in just a moment. These are the ligaments that are designed to stabilize your head as you're rotating like this. very common. People will say, I feel gristle or a kind of sound when I am turning my head. That can be where you've got damage to the ligaments, and that doesn't mean that it's unstable or that your head's going to fall off or anything like that, but it means things aren't moving right, and that has the potential to affect circulation and also neurology. In a nutshell, things are not going to be working the way that they are supposed to. More likely then we're going to experience pain, we're going to experience disequilibrium, we're going to experience some kind of functional disruption in terms of how well our brain is able to work. And then we follow that ligament up. Again, here's a good example where we should be seeing nice thick black right here. And we do. But as you go up to where it attaches onto this part of the bone, you may notice that it is thinner through this zone right here. This is what's known as the tectorial membrane. This is one of the ligaments that's designed to anchor the C2 pivot point for your head to the base of the skull. If that one is not quite strong as it's supposed to be, then it can start to tip backward a little bit, and then when we're moving the head up and down like this, it can start to produce a little bit of impingement, again, disruption, things in terms of what's going on with the brainstem, which only controls every vital life function that is in your body. The last one that I'm going to point out through here, this one is a little bit harder to see because of the contrast that's on this film, but you can follow the black ligament as it's coming up the back elements of the vertebra here, and you might see this little circle thingy right here. That's the back of the C1 vertebra, and if you zoom in, you might see that there's a little inward step or an inward deviation right through there, and then slight thinning of the ligament here. This suggests that not only do you have damage toward the front, but you also have damage toward the back, suggesting that in this particular case, the vertebra may be damaged and starting to misalign forward. And this is one of the most common kinds of things that we'll see when we're looking at DAX scans or CBCT scans, when we're looking at how the vertebra and the neck have actually misaligned. The top guy, only about 80% of the time, has that tendency to go forward. And sure enough, that's exactly what this individual has. So let's look at another slice that we have right here. So now we're looking front on this individual. And just to give you a bit of orientation, this here is the left side, and then this over here is the right side. So it's as if we're looking at them straight in the face. And what you may notice is you may notice this little peggedy structure right through here. So that's the tip of the C2. And then you may notice this little bow tie feature off to the side. That is the C1 vertebra. And what I will draw your attention to are where we've got, obviously, these pink arrows, is these little fan-shaped things coming out like this. These are what are known as the alar ligaments. These are the major ligaments that anchor the base of the skull to the C2, and about 60% of the time they also anchor into the C1 vertebra here as well. Now, I'll point out right here, when I say pitch black, that is what I'm referring to. And this entire slice here and off to the other side should be pure black. But what do we see instead? We see this whiteness right through here, and we also see it through the other side like that. That is what we're talking about. We're talking about not where the ligament has snapped in half, again, like a full-blown grade 3 tear, but we're talking about thinning. We're talking about damage. We're talking about the thing that should normally be this strong, that it's fraying like this, meaning there's going to be abnormal movement up and through this particular area. But there's a little bit more. Slightly different slice coming a little bit more toward the front. So same thing. So here's that peg that we were looking for right here. There's the little bow ties right through here. You can't quite see them as much because this is more toward the very front of the vertebra. But same thing again. What do we see? There should be a ligament right through here that is pure black. And same thing over on this side right through here. But what are we seeing? We're seeing all of these shades of gray through that zone there, and we're also seeing shades of gray through this area right here. So what we are seeing evidence of is damage of what's known as the transverse atlantal ligament. This is the number one strongest ligament that is in the neck, because if this one was ever fully ruptured, this one is like medical emergency to the point where you need surgery to stabilize the C1 to the C2. That's how severe this is. And again, this one is not torn all the way through. But what we're seeing is we're seeing pretty significant damage all the way through, because that area there should be pure black. It isn't. Now, even when we're seeing these different kinds of things here, and this is what I want to emphasize, is this doesn't mean that you necessarily need immediate surgery. But what it does mean is it does mean that you're going to need some kind of treatment that's going to help to promote stability, normal motion, and normal function of these particular areas. And this is the importance then of why, at least the particular brand of chiropractic that we do, specificity is the key. We don't want to be doing different kinds of adjustments in this area without seeing and knowing exactly what it is that we're dealing with. Because, again, if we were to adjust, say, the wrong way, person's going to feel a little bit worse. We don't want to take guessing games when it comes to this. We want to get as much information as we can so that we can make sure that we can be as safe as possible, as effective as possible, and then work to conservatively manage these different kinds of conditions. And most of the time, yes, we can. We can conservatively manage these conditions with gentle, precise, and custom-tailored treatment. Now, if things are not quite responding as we hope, then there's always the opportunity where we can increase it, either Regenex or prolotherapy kinds of injections. There's only a couple of centers in the US that do this because it is extremely specialized kind of work. And again, it doesn't mean surgery is imminent. That depends on the nature of the injury. In this particular person, I'd say, no, there's a lot of damage, but we don't need surgery at this point. That, again, would be when we see that there's huge amounts of tearing all of the way through. But everybody's case is going to be individual. So we have to make sure that we are taking a tailored approach and being as conservative as we possibly can. Right, now there's one more image that I do want to showcase here. And this one, I believe, represents what a huge amount of people actually experience. Brain fog, headaches, migraines, disequilibrium, especially if they say, I feel better usually when I lie down. So I'm going to point out a few things here. Firstly, I'll point out a few of the things that, I've already, touched on. So we've got our pink arrows right through here. So now we're looking top down. At the top of the C2, that's this halo that you see right here. And the vertebral body of the C1, so this is the little side projection. If you put your finger just below your ear on both sides, that's the little tippity that we would have right there on the, again, here's your orientation. So left side is over here, right side is over here. So here's the tip on the right. Here is the tip on the left. And then here's where your spinal canal and where your spinal cord should be sitting. So here would be those ligaments that we highlighted earlier. Again, everything should be pure black, kind of like this right here. However, what we see in this space off to the side is we see this grayness through here, and we also see this grayness through here. So again, we're seeing the same kind of ligament disruptions or thinning that we saw in the other slices, and that's why we never want to put all of our faith in just one slice. We want to be able to see things three-dimensionally to get the best appreciation about what's actually going on here. What I will also point out is this black circle you see right here. This should be spinal cord, and we're talking at the level of the C1 and the C2. You may notice that there is grayness through here and also a little bit through here. What is that? That's actually the cerebellum. It's part of the brain itself. So what's happened is that should actually stop about 3 millimeters above the very base of your skull. If we're starting to see that that's descending down into the spinal canal itself, this starts to create direct mechanical pressure where it can irritate your neurology, or it can start disrupting circulation of the fluid on the inside. So again, people say, I feel pressure behind my eyes and my forehead. And I tend to feel better when I lie down, because when we are sitting up, standing up, that's going to create a little bit more downward pressure like this. And when we lie down, it tends to buoy up just a little bit, not creating as much agitation or disruption. Now, I've done a lot of videos on this channel. It falls in the category of what's known as a Chiari malformation. That is where either the cerebellum, the balance, coordination, the conductor of the brain, and or the brainstem starts to descend down like this. And from the medical pathologist standpoint, again, that's not going to be diagnosed unless you're dealing with the descent of at least 5 millimeters. However, when you're dealing with ligament damage in the upper part of the neck, all it may need to do is go down by 1 millimeter to start to create issues. And I use this as a common example. Let's say that you're a size 10 shoe. Could you fit your foot into a 9.5? Yes, you could, but you're going to feel more tightness. That's what this represents. It's what's known as a cerebellar tonsillar ectopia. It sometimes also fits into what's known as a Chiari 0 malformation. So again, do we see a reason? Why is this person experiencing disequilibrium? Those are part of the balance coordination centers of the brain and the body. Well, that would make sense. But we're going to show one more thing on this particular slice right through here. And these are going to be a few black circles. So again, I'm going to outline the front of the C1 vertebra in the neck, kind of like this right through here. And I want to draw your attention to this black circle right here and this large oval that we see right here. This here is going to be the internal carotid artery. This is what's supplying 2/3 of all of the blood to your brain, particularly the upper and the forefront, for thought, for all of our different motor functions, things like that. And then this guy right here, the big one, this is the internal jugular vein. This is the one that's responsible for draining the vast majority of blood from your brain back down toward your heart. In other words, this is the major plumbing conduit, especially when you are lying down. But check this out. We come over onto the other side. Okay, there's our internal carotid artery right through there, and you'll see that it is just a little bit smaller than it is on this other side. This could be the person's normal anatomy, or this could be a sign where something has actually shifted off a little bit. The vertebra is misaligned, and as a consequence, it's narrowing that area there. But let's go side to side here. Here's that big black oval on the right side. Where is it on the left? It's this thin little thing that we see right here. It's almost gone. One of the major plumbing or drainage pathways from the brain is being narrowed in this area right through here. That's not going to be a good thing, because veins have the lowest pressure of all structures in your body. If there is a narrowness, if there's a constriction going on right there, guess what? Fluid starts to backflow, accumulate, and congest inside of the brain itself. And if the fluid's not circulating right, remember what we were talking about, brain fog or symptoms oftentimes associated with concussion or chronic pain or any number of different neurological conditions, we're finding that it's related to a congestion of the venous drainage systems. The internal jugular veins are some of the biggest ones. We've got a good one on this side, but we do not on this side here at all. And again, this person's MRI, everything was said to be normal. So what we're seeing right here is, no, things are not actually normal at all. And again, there's no tumors, there's no multiple sclerosis, there's no bleeding, there's no infection. I agree, there's nothing like that going on here. But what we are seeing is plenty of evidence of functional disrelationships, and that when you add each of these pieces of evidence together, this gives a much clearer picture about why this person is experiencing the different symptoms that they are. Now, we still need to do a few additional tests then to figure out what's the most appropriate treatment? Is this something that we can work with conservatively? Is this something where a person may need injections? Is this something where a person may need surgery? And this person does not seem to be where they need surgery. Thus far in the course of their care, they are just reporting improvements. And this is with doing the specific craniocervical or upper cervical adjusting procedures that we are doing. They're not completely out of the woods just yet, because again, this has been oncoming for a while, and I don't see the need for surgery, but we're going to be keeping a close eye on things to see then if something may need to be done to help where those ligaments are ultimately going to be made a little bit stronger. Now, that's not something that falls in my area of expertise, but it is important that I'm aware of that so that if and where we may need to make a referral to up the ante so the person can do even better, that we're very aware of all these things going on. So there we go. A bit of a deep dive into an MRI that was quote unquote normal. But again, when we start looking at all these little things add up, it gives a much clearer picture about, even if we're not dealing with overt pathology, that we're in this huge gray zone that more than explains why is this person experiencing what they are. So there is hope and there are answers. We just need to be able to look at things in a slightly different way. So hope you guys did find this video both educational but also valuable and not too terribly boring either. So if you did enjoy this one, please do always click that like, subscribe button and share this video. Friends, family members, clients, colleagues who you think would need this information. They've been to doctor after doctor, specialist after specialist. Their tests keep saying that everything is normal. Share this information with them because it may mean that the information's there. We just need to look at it from a slightly different perspective. If you want some more information then about the particular brand of healthcare that we're doing, you can visit my website, clearchirospokane.com, where we've got links to videos, blog articles that talk about all the different kinds of conditions related to the upper part of your neck and the different kind of healthcare that we do that can help help you ultimately get your health and your well-being back. Stepped on that one just a little bit there. So check it out. It's clearchirospokane.com. Thank you guys again for watching very much. This is Dr. Jeffrey Hanna. Get well, live well, stay well. Till next time, take care. Bye-bye.